fall's a unique time period, and I've always enjoyed the change of colors. Certainly it's the prettiest of all the seasons, I think. I was born and raised in Pittsburgh, and I lived a year once in Florida, and that was it. Other than that, I've been in Pittsburgh. I'm retired now and married for 43 years to Karen, my wife. We've got 3 daughters and all married and 4 grandchildren.
Family to me is everything. All 3 of my girls live outside of Pittsburgh. Always tease that, you can take the girl out of Pittsburgh, but you can't take Pittsburgh out of the girl. We've not seen everyone together since our summer vacation.
It's been rough not seeing them, so we cherish those moments. My family's everything. That's why I'm fighting to stay here as long as I can. My name is Bill Kahi, and I've been diagnosed with mesothelioma, pleural.
So mesothelioma is a rare cancer that develops along the protective linings of our organs, most commonly in the chest or in the abdomen. Mesothelioma can occur along the lining of the lung, the lining of the heart, or even the lining of our abdomen or stomach. Now, the most common type of mesothelioma that we see is malignant pleural mesothelioma, which is disease of the lining of the lung. That accounts for about 70 to 80% of cases. So if you go back and look at the history of patients who develop mesothelioma, about 70% actually have a direct connection to asbestos exposure. We are still learning about how long it takes, how much exposure actually leads to the development of mesothelioma. There is obviously some triggering event that causes the development of cancer in each individual patient.
I went to work in the mills in January of '77 to mid-'81. Our job was to reline the furnaces with refractory material. And somewhere along the line, I got exposed to the asbestos. But yeah, the mills were huge around here.
Working in the boiler room of a ship, working in a shipyard itself, in brake repair, in construction, and really with insulation material. All of those industries used asbestos for a number of years.
It was very good as a flame retardant and fire retardant and did its job. But unfortunately, because of the type of fiber it is, it gets into the lungs and you can't get it back out. The side effect is it gave people this cancer.
For mesothelioma, the fibers themselves, when they go into the lining of the lungs or they're inhaled into the lungs, those fibers are thought to cause cancer via 2 mechanisms. So the first is the fiber themselves that actually causes the development of a cancer like mesothelioma. The second is the inflammatory milieu that surrounds that area, those fibers. And those reactive compounds and the cells that are activated during that process over many years end up leading to the cause and development of mesothelioma.
They knew it was a health hazard for sure, but it was supposed to be gone from products by that date. They'd begun removing it years before that, but not everybody did because it worked so well. I'd heard it was a healthy material, but exactly where it was found and everything, I didn't know at that time.
In the United States, at least, we learned this lesson from 1970 to 1980, and therefore we saw a decline in the use of asbestos in each of these industries, which led to a subsequent decline in our incidence of developing complications, such as mesothelioma.
When Bill started experiencing symptoms that, weren't the norm for him, he's always been one to work out. He would just be commenting that, his sets weren't as hard or he didn't do as well.
I just started noticing that I was getting out of breath quicker, a little more trouble recovering, that kind of thing. My number of reps I could do were dropping off, and I just couldn't understand it. I was working just as hard. Why was I going backwards?
He had some coughing. I had brought up to the doctor that he did have a past where he worked in the mills for, several years and would have been exposed to asbestos. Could this be something that we're looking at? And he really didn't commit one way or the other, but he knew that with the testing that they would be doing, they'd be able to identify what the problem was.
They sent the results back to the pulmonary specialist. We met with him again, and he sent me up with a surgeon. February 1st of that year, I had my surgery where they drained everything, and they had to talc the lungs so so it wouldn't expand too quickly. They took tissue samples at the same time.
That's when the diagnosis was confirmed, was after that surgery.
So depending on when a patient presents and with what symptoms they present with and in what situation, the test can actually vary. Sometimes it could be a chest x-ray for somebody who is developing some shortness of breath but needed a quick workup. Sometimes it could be directly a CT scan of the chest. Sometimes patients have hoarseness in the voice, and therefore that leads to other types of imaging in the body. But ultimately, most patients actually present with some sort of pressure or difficulty breathing from fluid buildup in the lung.
While I was thinking of the 1,000 things that, ran through my mind as to what it could be, meso was probably one of the ones I didn't want it to be, because everyone knows percentage of people that are still alive after 1 year, 2 years, 5 years. So, I knew that that was a worst case scenario. But on the other hand, I knew that it was Bill fighting it, and that if anyone would beat it, he would.
To describe my dad in one sentence would be, he's the strongest person I know.
Strong, selfless. I mean, he is somebody that never, ever has put himself first.
He's extremely humble and just driven, too.
He's always been incredibly determined. Growing up, he was just he took such great care of himself and so healthy and very systematic about his exercise and his diet and his activity levels, that the focus of that now has changed from just taking care of himself to fighting this.
People that get diagnosed with this will have the attitude that beating it is the most important thing. That's what I'm trying to do.
Bill's been diagnosed with mesothelioma for 2.5 years now. When he first started treatment, there wasn't a whole lot out there. The standard chemotherapy has, been the same for the last 15 to 20 years. So we found that he was eligible for a clinical trial with immunotherapy.
Given the aggressive nature of mesothelioma and its disease course and the rarity of its occurrence in our population, it's been very difficult to make advancements in the field of mesothelioma. In 2019, Tumor Treating Fields were approved by the FDA as a treatment option for patients who have advanced disease and could not undergo surgery. It is used along with chemotherapy, and they basically deliver alternating electric energy. They are low-intensity, intermediate frequency fields that are generated from transducer arrays or pads that are placed on a patient's chest. And we can design that array of placement so that we can maximize the field energy in the area of their disease.
So I've been wearing that since mid-May. The first scan I had after I started wearing it showed some improvement, but it was only 2 months after I started with it, so it's very positive. We'll see how it goes. Okay.
Was that all of them?
That's all.
As with any medical condition, you have to understand your body and what feels normal to you and what, feels a little bit off. And if something feels off, don't be afraid to go to the doctor.
Well, certainly if you did any kind of work in that situation where I was in the mills, yeah, you should be screened. I wish I would have. Incoming.
If a patient is diagnosed at an earlier stage of disease and potentially can undergo chemotherapy, surgery, potentially radiation therapy, then potentially there's a chance for a longer survival. But again, that is very patient dependent. The histology is important to consider as well, and really the extent of disease.
Mesothelioma always scared me, but I see how hard everyone is working, in this field to get a control of it. They refer to meso as an orphan cancer, but there's a lot of research being done on mesothelioma.
It makes me really hopeful for the new frontier of therapies that are available for patients. In fact, now that we have these new therapies, we're looking at combination approaches as the next cutting-edge treatments for this patient population. There are new studies that are combining chemotherapy and immunotherapy. Those studies have been done in lung cancer and shown promise, and now we're translating that to mesothelioma as well.
So Bill always has been a very strong person. He really believes that the more motivated that you are and the more physical that you are, the better your overall condition will be, which would give you a better chance of fighting his battle.
He has the best care system. My mom would do anything for.
I'm definitely hopeful because of just his attitude. He's the reason why we're getting through this as best as we can.
It's easy to have hope when he's your example.
Yeah.
We've never talked about, you've got this much time. We've never brought that up, and I don't ask.